Hello and welcome everyone to our video for nurse practitioners and physician's assistants. In this video, I'm going to demonstrate how to put in a verbal order for an admission order in the emergency department. So let's go ahead and get started. The icon that I'm going to look for when I'm starting to do this process is this orange ambulance. When I click on it, I will be prompted to put my credentials in, and then it will log you into the tracking board. So this will be what your screen will look like. The main thing that you need to pay attention to on this is that in the center of the screen, you will see a list of all the patients in the emergency room. So I can scroll and find my patient that I need to put an order in on. And all I do is single click on the patient to make the little blue bar appear across their name. From here, I'm going to click on the icon to do the verbal order. To do that, I'm going to look up here to the top. I'm going to find this icon right here. It is the CPOE verbal orders icon. We affectionately call it the Screaming Doctor. So I'm going to click on that. Now, this is going to launch us into Clinician Hub, but it's in a different route than what you're used to. Okay. When this screen appears, you're going to want to direct it to the physician that you're doing that you want to sign off your order. Okay. Majority of the time, all of the time, it will not have your physician's name right there. So you will have to search for it. So I'm going to click on this little search icon right here. And then I'm going to type the last name of the person that I'm looking for. So I'm going to type in their name, hit enter. And that is not my correct name of the physician that I want. So I'm going to click on this down arrow. Okay. So Dr. Matthew Joseph, that is the correct one I want. So I'm going to choose that doctor, select, confirm that that is my correct doctor, and then I'm asked a question. Is this a telephone, verbal, or protocol order? It doesn't matter which one I choose. All three will go to the physician for a sign-off. So I'm going to choose a verbal order. Then I'm going to click Enter New Order. And now this is the part that looks very familiar to everyone. So I'm going to my search bar and I'm going to type in quick. The order set that I'm looking for just to place that patient as order is my quick admission order set. When I click into that, what I see is essentially the top section of the admission order set. Okay, so I'm going to choose whichever one of these choices is most appropriate for my patient. I'm going to check this one. I see that it has a red stop sign. The red stop sign means that there's something in there that's required. Okay, so I'm going to click on that order. It takes me into this part of the order, and I'm going to go ahead and click into the instructions part because BedBoard needs a few questions answered from us when we put in these orders, and that is who my admitting physician is, who my attending physician is, and what the patient's diagnosis is. Okay. From here, remember I said we had to make this order required for you guys to put in this information. To make it required, we had to make one of these stop choices a requirement for you to answer. And that is this reason or indication right down here. So if you will just click on one of these choices and click Save. And when you go back to the order set, you see your stop sign's gone. And now I can go ahead and start processing this order. Now, if I look up here at the top, because I'm in as doing a verbal order, I do not have the option for a submit right here. Instead of submit, I only have save, so I have to click save here. But in doing that, I've not fully sent that order off to the BedBoard, okay? How I send that order off is I go to the submit button, and the submit button is hidden in the order queue. So I'm going to go to order queue. And then this first icon on the left is submit. So I'm going to click submit. Here's my 2 orders that I just placed to Dr. Joseph. I go ahead and single click them, or if I click this select all, it will click all my boxes for me, and I can click submit in the bottom left. And now my orders have been placed. So I can X out of Clinician Hub. I'm back to the tracking board. Okay. Now, there probably is more orders that I need to place on my patient, but probably I don't want to direct them all to the attending physician. So if I want to do some orders as me as a nurse practitioner doing all the submission of the orders and everything, here's how I can do that after doing that section of the verbal order for that admission place patient as order. So I've got my patient highlighted in the blue bar. I'm going to come up here to the icon next to my screaming doctor, which is my CPOE button. Okay, so I'm going to click on that. When I go in this way, it is exactly like if I just logged in to Clinician Hub just as myself. Okay, so here I'm going to go to search. I'm going to look for that admission order set. I'm going to choose it. When I get into the order set, since I just placed that telephone verbal order for this part of it, I want to deselect this portion. And now I would continue down here with the rest of my orders as I need to. When I'm done, because I am in as a nurse practitioner, I do have this submit button now. So I can submit all those orders. Now all my orders have went off. I've directed the one order that I need to the attending physician for them to sign off, and because I went into the pencil icon, the CPOE icon, I've completed the rest of my admission orders for my patient. All of the orders done both ways will show up for the emergency room nurses to look at to see what you've ordered for the patient. This has concluded our video on how to do an admission order as a verbal order. Thank you.